Hi, my name is Roberta Ferguson. I'm a nursing student at Durham College, and today we're going to be doing, for my critique, I'll be administrating medication. So today the medication that we'll be administrating would be acetaminophen. The classification for it is a therapeutic drug. There's three ways you can take it. So by mouth, by rectum, and IV. So by mouth, the onset time is 30 to 1 hour. And then the peak time for it is 1 to 3 hours. The duration is 3 to 8 hours. Rectum would be 30 to 1 hour. The peak time is 1 to 3 hours. The duration is 3 to 4. For IV, it's within 30 minutes. The peak time is 30 minutes. And it's 4 to 6 hours for the duration. Some side effects that you could experience with it is agitation, anxiety, headache, fatigue, and insomnia. And then later on, I'll be doing 2 health teaching. So now I'm just going to sign the signature sheet with SBN1, and then my first and last name, so RF. So after I've done that, I'm going to take the MAR and the doctor's orders and then compare the two. So the patient is Citgarden, and then Citgarden is on the MAR. The MRN is 4316, sorry. So 344316. His date of birth is November 8th, 1965. November 8th, 1965. The allergies are codeine and penicillin, so the patient's allergies are codeine and penicillin on the MAR. The date is March 25th, 2020. The drug is acetaminophen. The dose is 650 mg, and the dose is 650 mg on the MAR. The route is PO or birectum, and then it says the same thing on the MAR, so PO/PR. It's every 6 hours, and then every 6 hours on the MAR, and then it's as needed for pain for 4 days. And any special instructions would be to not exceed 4 grams per day, and you do it for a total of 4 days. And the time that you want to administrate it is at 1800. And it's signed off by the doctor. Okay, so I'm going to put that one away. So I'm just going to keep the MAR out because we're going to need it later on. But for the medication, I'm going to be doing his medication history. So Sid's medication history, he has a history of allergies, so penicillin and codeine. He has type 2 diabetes, asthma, hypertension, peripheral neuropathy, myocardial infarction 2 years ago, and that's about it for his past medical history. And his present illness would be he's experiencing complications due to infection. Okay. So after that, I would do a pain assessment on the patient. I do the patient's vital signs if needed. I'd ensure that the patient can swallow, so he could take the tablets for it. And I'd also look at the lab scores if needed. So now that I'm done reading, and I'd also review the medication policy if I didn't already state that. So now that I'm done reading all of that, I will keep the MAR out, but I'm going to do hand hygiene because we're going to take the medication container out now. Okay. Alright, so before I even open it, I will look at the expiry date, and it expires February 2021, so it's good. And it is the right medication. It does say acetaminophen on it. So after that, I'm going to start comparing the MAR to the medication bottle. So it is a stock drug, so his name won't be on it, but for verification purposes, I'll just pretend like it is. So the patient's name on the MAR would be Critque, and then allergies, penicillin, codeine. The drug is acetaminophen. The dose is 650, and the dose on this is 325, so we are going to be doing calculations. The route is by mouth because I've ensured that the patient is able to swallow, but it can be done by rectum too. Frequency is every 6 hours. And then the directions would be not to exceed 4 grams per day. The site is by mouth, and the reason is for post-operative pain. And then the time I'll be administrating this would be at 1800. So I'm just going to do it again. So patient's name is Critque. It's not going to be on the bottle because it is a stock drug. His allergies are penicillin and codeine. The drug is acetaminophen. Acetaminophen is written on the bottle, and acetaminophen is written on the MAR. The dose is 650. The dose on the bottle is 325, so we're going to be needing to do calculations to get the right dose. The route is by mouth, and I've ensured the patient can swallow. The frequency is every 6 hours, and the site is orally by mouth, and the reason is for post-operative pain, and the direction is not to exceed 4 grams per day, and he will be taking it for a total of 4 days, and the time would be I will be administrating it is at 1800. So after I've done that, I would need to do calculations for it, like I said earlier. And so I'm just gonna put this to the side right now. So I'm gonna take a cue card and just do my calculations on there with my calculator. So the formula, just gonna move this over, is D over H times Q. So 650 mg over 325 mg times 1 tab. Okay, so that gives me a total of 2 tablets, and I boxed in my final answer. Okay, and then I'm just going to put this to the side for now. But I am just going to double check on my calculator to make sure I got the right answer. And I did, it gave me 2. So I'm going to put the calculator and the paper to the side for now. And now I'm going to, since I did my calculations and I got 2 tabs, I'm going to pour it out now. Into the lid first. Okay, pour it in the cup. I'm just going to close it for now, but I'm not going to put it away yet. I'm just going to do the MAR and I'm going to do my third check. Okay. So with my third check, his name is Sid Garland, and the drug is acetaminophen. The dose is 650 on here. On the bottle is 325, so I would be doing calculations, which I did, and I got 2 tabs. The frequency is every 6 hours, and the directions is not to exceed 4 grams per day. And the site is by mouth, and the route is PO if I didn't already say so. The reason is for mild post-operative pain, and he will be taking it for 4 days. And like I said, I'll be administering it at 1800 because that's the next one that hasn't been administered yet. So after I put that away, I'm just gonna flip it over and do it on the empty side. My calculations one more time. D over N times Okay, so 650 mg for 325 mg times 1 time. Calculate. And that gives me 2 tablets. So after doing so, I'd make my tester check my answers and to make sure they're right. And then after that, I could put the medication bottle away. Okay. And then before entering the room, I do hand hygiene one last time. Okay, so when I enter the room, I'm going to introduce myself. So my name is Roberta Ferguson, and I'm a dermatology nursing student, and today we'll be administering drugs, so I'd let the patient know what we're doing, and I'd gain their consent. So after getting the patient's consent, I will do an environmental check, making sure like the brakes are down, bed rails are up, bed is in the lowest position, oxygen and air is working. After doing that, then I would look for the 2 identification tags. So it would be the patient's name, so Sid Garland, November 8th, 1965. And then I'd look for their allergies, and it would be penicillin and codeine. So these 2 tags. And then after that, I'd ask the patient their history of allergies and how do they react to it, like do they get rash or redness. So yeah, and then after that I do 2 health teachings. So the 2 health teachings that I would tell the patient to do would be to not exceed 4 grams per day and to not take alcohol or drugs with the medication that they're taking. After that, I would raise the bed in high fowlers, give the patient water. Like I said, the patient is able to swallow, so they're able to take the medication. So I make sure that the patient is in high fowlers to take the medication. I position them right, and then I would give the patient water. I'd administrate the drugs, so the 2 tablets, and then I'd ensure the patient has taken the medication before leaving the room. And after that, I would sign off on it. So I'd sign off with my co-assign. So I'd put PO, my name, because they're taking the medication by orally, my name, and then I'd need my tester to co-assign on it to ensure that I've done the right thing. And before I leave the room, I would put the bed back down, ensuring that the patient is safe, and I would ensure the patient is safe, there's no environmental hazards or anything like that, and I'd get my co-sign to sign off on it. I'd sign off on it with my signature and their signature, of course, and the way the patient is taking the drug. And then I'd leave the room and then do a post-assessment 30 minutes later, and then that's about it.